Appreciate today's message. And if you are a medical doctor, I invite you to follow up with further exploration. Today, I'm going to tell you about a Chinese doctor in Wuhan and his miraculous cure for coronavirus, an approach combining traditional Chinese medicine and injection. That is the story of Dr. Yue Hua. When I was shown some video footage on China's social media of a doctor doing injections on patients' neck in Wuhan during the height of the pandemic, I was surprised to see that this doctor not having any protective gears, not even a face mask. That was the legendary local Chinese doctor in Wuhan, Dr. Yue Hua, who has cured 18 coronavirus cases with his simple method of doing injections to certain Chinese acupuncture meridian points. Later on the chat interview, I was told that his approach does not only provide fast treatment on coronavirus and suspected cases, but also helps people stay immune to this virus. I'm going to translate below a written interview of Dr. Yue Hua, which has been widely distributed across Chinese social media. First question, could you please tell us more about your approach? My approach is to inject a very little phenol into relevant Chinese acupuncture points. In the case of dealing with coronavirus, 4 points around the neck. Is the phenol safe to inject into human body? Yes. Phenol is an FDA-approved human use medicine and injection. In China, it's approved too. The government standard for injection is no higher than 0.5%. In my approach, I use only 1/75th of that standard. Injecting phenol is nothing new. The insulin diabetes patients use has a phenol element. As to the acupuncture points to do the injection, is it crucial to inject into the exact location of that acupuncture point? No, actually you don't have to be 100% accurate. Just around about that location will generally work. Next question, then why should people be convinced that your approach is effective in treating coronavirus? I would invite them to look at 3 facts. Fact 1, I have cured 18 COVID-19 cases, including 5 serious cases, 5 elderly cases, including 1 person over 100 years old. They have now all tested to be negative. The third fact is that myself, my wife and my assistants came in close contact with patients without much protections, sometimes not even a facial mask, but none of us got infected. So you established this approach in the year 2004, and then in the year 2011, you got China's patent. During the past 14 years, what other diseases that you have successfully treated with this approach? Well, to start, I successfully cured my own rhinitis, and then healed my wife's tonsillitis. And then later, I treated a lot of cold, flu, or bronchitis, all of whom recovered quickly. Once my friend's 1-year-old was hospitalized for high fever and couldn't get better after 1 week in hospital. So I asked him if he would like to try my approach. My friend took his son over to get the injection, and the boy's fever stopped the next day. After that, I started to experiment on shingles, which was also very successful. I have also successfully maintained the health of an HIV/AIDS patient. So that was the translation of a part of his interview. Understandably, hospitals and other medical facilities are slow in adopting such an unconventional approach, let alone it takes both Chinese medicine and Western medicine backgrounds. But from the fact that over 100 doctors and nurses have gone to him to get preventive shots, we should seriously pay some attention to this method. Through this video, Dr. Li is inviting medical professionals from all around the world to follow up with him. As a matter of fact, Dr. Li has given away his tips to the Chinese media. In light of different legal environment, we are not going to translate the whole guidebook through this video. However, Dr. Li welcomes medical professionals to contact him through those contacts on the screen.